The following program is a production of WXCL Television.
Coming up next on WXCL TV, a special report on the critical condition of health care in our communities and just what is being done to improve it. This is South Florida Today. Good evening, I'm Tony May. Tonight we are taking a look at just how many of our residents right here in Palm Beach County are getting sicker, simply because they cannot afford health insurance. And it's not just a problem for the very poor. A growing number of middle-class families are facing the exact same crisis. In a few weeks, WXCL TV will air a Frontline special that puts a human face on the nation's 47 million people living without the help. So we wanted to do the same right here in our neighborhoods. Our first story introduces us to two women who personify the problem. But luckily for them, there is a program in place that is helping.
How are you doing today?
Sandy Collier is used to being in hospitals.
I've been licensed practical nurse for 35 years. I graduated 35 years ago last March.
But Sandy got sick and lost her job and found herself in a situation she never imagined.
I couldn't work. I didn't have money to pay my rent. I didn't have health care coverage, and I couldn't get anyone to really do anything for me medically.
Without health insurance, she ended up in the ER and was diagnosed with endometrial cancer. The only hope was extensive and expensive chemotherapy.
I went so long actually begging for some medical help. And my people were born and raised in this country, and the health situation, insurance coverage, as I think a lot of people are aware of, is in a tragic situation.
Is the pain medicine controlling your pain a little? Are you able to do more? Are you able to be more active?
The pain medicine, definitely. Otherwise, I wouldn't be able to sit here and talk to you.
Sandy did not know where to turn. She literally had to decide between paying her premium or her rent.
Me paying $700 to live in a room, it leaves me $150 left. So now I'm not able to go to any of the doctors that Dr. Zito refers me out to, any of the specialists, unless I pay for it.
This former nurse was desperate, and someone told her about a county program that provides insurance coverage for some who qualify. The Coordinated Care Program is funded through property taxes and is what got Sandy to the doctor she so desperately needed to see.
I was introduced to Dr. Zito, who really listened, which is a dying breed these days.
If you just look around and you see the number of patients that we have here, I'd say a year ago we had a little bit of a decrease, but over the past 6 months to a few months, we've had a drastic increase in the number of patients coming that have been losing their jobs that as a result have lost their insurance. But we've seen a very big increase in our numbers.
Dr. Zito says thousands of patients a day come through the doors at the 45th Street Clinic. Some, like Sandy, are very sick. Others just need the basics.
We do everything from just a healthy, well child physical, like in pediatrics, we do a lot of well childs. In our adult medical clinic, we do everything from a physical for a healthy 20-year-old, but we also do, we see a lot of chronic disease. We have a lot of hypertensives that are out of control, a lot of diabetics, a lot of heart disease. So we do, you name it, everything.
It was a problem because of the insurance, the share of cost.
All right, so
It was a mess.
We'll have to talk to our referral clerks and see if we can get her to work on really trying to get you a urologist that will see you with this insurance that you have.
That's the reality of things. And more people, believe it or not, most of them that are working now are unable to afford insurance.
Yannick Gripkov is the nursing director here. She says the numbers have risen dramatically in the last 6 months. So much so that those who work inside this clinic are heading out to the streets and shelters like Cafe Joshua. The aim is to try and offer those without hope a little bit of help.
As you get your insurance, we make you an appointment at the clinic for a complete checkup.
Almost like a third world, right here in West Palm, because that's how that's exactly how it's becoming, and we discuss that sometime when we go out on outreach, especially in the Belleville area. You know, even here, right here in Jupiter, we go to El Sol. You have a large population of people. Without us, they have no place to go.
Leslie Christian is one of those who had no place to go and got help through this outreach. She admits she was an addict and living wherever she could.
You have nowhere to turn. You find yourself just relying on 911 to get you to emergency room. Sometimes that was the only medical care some of us, when we were homeless, got.
After getting medical help for both her physical and mental problems, Leslie got a job and is now in college getting her social worker's degree.
I can't go down a road to help somebody be a doctor. I'm not a doctor. I'm a recovering addict. I'm recovering from homelessness. I'm recovering from so much. And there's somebody out there that don't know this is here. So they need me out there to let them know what's here.
She volunteers on the board of the health department and believes she is off the streets because of her will and the free care.
Yeah, I just want to do some follow-ups and then also go upstairs and check about some meetings that were going on.
Okay, so
without the strength and the determination, I probably would still be out there if it was not for the encouragement and help from the doctors. I would still be out walking the streets of West Palm Beach, and you would not be interviewing me. You'd probably be trying to figure out, do forensic, who am I?
So without the healthcare district, Tony, I would be in my grave.
It is these success stories that keep those working in this overburdened system going. But they know without change at the top, even the best plans will soon not be enough.
Whoever is going to be our next president, you know, they work on healthcare and see, you know, if there is a resolution as to what type of healthcare we need to have in this country so that people have access and not suffer the way I see the suffering.
Now, if you would like more information about the Health District programs, please call them. That number's on your screen. It's 1-866-930-0035.